Hello, thank you for inviting me in your podcast. And I'm Vesna Kesic, this is my name. I'm coming from Belgrade, Serbia, southeastern Europe. And I'm a gynecological oncologist. I'm a professor of obstetric gynecology and then subspecialized for oncology. Now I'm retired from a clinical work, but I became an emeritus professor, which is making me really very proud, not because of the title, but because of the chance to transfer, to give my knowledge to younger generations. My work was for many years focused to oncology, gynecological oncology, but after a long time of treating patients, sometimes successfully, sometimes without success, I realized that probably in oncology the most important part is prevention. Prevention is coming slow and getting slowly the results, but it is powerful. It is stronger than curative medicine because it can save more lives. So all my work was about first gynecology, later prevention, and I'm very happy that in European Society of Gynecological Oncology, which is a good and active society, we formed the group for prevention of gynecological cancer, which is very active and which maybe once, if you have time, we can talk about. It's a difficult question because you young generations, you are growing up with digital technologies, with modern technologies. For me, colposcopy will always remain the most beautiful method. But it is the fact the colposcopy hasn't been changed for almost 100 years. It's an excellent method, and the techniques of colposcopy is the same. But digital era brought many improvements, and then it started in 2000 with the beginning in 90s. In fact, the first colposcopes appeared, digital colposcopes, which were not just looking through the eyepieces, but the doctor could look the screen, the patients, and the other colleagues. A little bit later, about 2000, computer-assisted tomography, computer-assisted colposcopy appeared when computer picture was colposcopy picture was saved in a computer, serving as a good basis for follow-up, for comparison of findings. And now today there is artificial intelligence assisted colposcopy, which seems to be probably the major advancement. If we take the accuracy of all these different methods, the accuracy, that means colposcopy as each other method is not perfect, and its accuracy is about 50 to 60%. According to the papers, I'm speaking about conventional colposcopy. Then you have all these new methods like artificial assisted algorithms. I think they will be the best, that they have the highest accuracy, which is reaching 98, 97, 98. In between these 60 for classical conventional colposcopy and artificially assisted are different methods which are digitally aided colposcopy, like it's called dynamic spectral imaging colposcopy, which is giving a map, like a weather map, weather forecast map, where the difficult parts and severe lesions are marked with different color, and it really makes difference for practicing colposcopies. But what I think would be probably the best way to apply new technologies in countries like in MENA region, it would be probably digital hand colposcopes, which can even in remote areas record the picture, send it immediately for consultation, which is I think the best way to come to the remote areas and women that would probably not ever come to screening, even if there is organized screening. So I think the artificial intelligence will really make a big shift, but there is. I mean, we don't have time to talk about the techniques itself. The big limitation of colposcopy is that we don't see in the canal, we don't see in the entrance of the cervix. And this is the thing that artificial intelligence also will not be able to overcome. So we are looking forward for some new technology which will be able to examine the small endocervical canal and give us probably artificially assisted algorithm. But the future is coming fast. So it's already tomorrow, and we can expect next time when we meet that we shall have more new technologies.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.